In this animation, we want to explain how to keep your teeth healthy for as long as possible, maybe for a lifetime. The human jaw commonly has 32 teeth. The visible layer of the teeth is the enamel, which is the hardest substance in the human body. Tooth enamel consists to a large degree of the phosphate hydroxyapatite. The teeth are anchored through cementum, which here appears yellow on the dentin, to the periodontal ligament in the alveolar bone of the jaw. The periodontal ligament in the alveolar bone consists of Sharpie's fibers, which act as a buffer medium against stress when chewing. Nerve tracts and blood vessels, which supply the tooth with nutrients, are located in the pulp cavity. Dentin surrounds the pulp cavity. The most common diseases of the teeth and the periodontium are caries and periodontitis. Let's look at caries first. In the early 20th century, the dentist Weston A. Price traveled the world, comparing traditional with modern diets. The conclusion of his research was that an excess of sugar and white flour in modern diets is probably responsible for tooth decay. Sir Robert McCarrison traveled to India at about the same time and investigated the connection between diet and health. He came to the same conclusion as Price. Our oral cavity is colonized by countless species of bacteria and fungi. They protect teeth and gums, promote good breath, and do many other good things. However, if bacteria and fungi become deranged, this situation is called dysbacteriosis. Dysbacteriosis is also called dysbiosis, and it can be caused, for example, by the intake of too much sugar. Some bacteria in our oral cavity feed on sugar, other bacteria do not and then lose out. Bacteria that do not feed on sugar become fewer. Bacteria that love sugar can thrive and grow. One metabolic product of certain bacteria is acid. They turn the sugar into corrosive acid. The acids produced in this way lead to a demineralization of the tooth enamel, that is, a breakdown of calcium and phosphate. Our saliva normally contains many calcium and phosphate ions that initiate remineralization. However, in the case of a dysbiosis, so much demineralization takes place that the enamel cannot be rebuilt quickly enough. This leads to tooth decay or caries. The acid eats its way further and further through the tooth. Eventually, the hole is so deep that the bacteria in the mouth can reach the nerves and blood vessels, damaging and eventually killing them. But are bacteria really the problem? Our digestive tract consists not only of the oral cavity. All of our digestive organs are colonized by countless bacteria and fungi. So, regarding the oral cavity as an isolated region does not seem very helpful. Food that leads to dysbiosis in the mouth will probably lead to dysbiosis in the entire digestive tract. Back to caries. Teeth of mountain gorillas practically never shows caries. However, teeth and tongue show a black coating that comes from the food. The tannins in the plants eaten cover the teeth and the tongue. since the food cannot clean the mouth effectively, deposits, heavy tartar, and periodontitis develop, which eventually leads to the loss of teeth. On the other hand, the mouth of lowland gorillas does not show this discoloration. They also eat many plants with tannins, but also fruits. Fruits and roots seem to have the ability to clean the oral cavity effectively, because tartar, periodontitis, and caries hardly develop either. Wild animals rarely have caries because their food consists of natural, raw products of nature. And we too once ate exactly the same way. We'll see in a moment how we can effectively prevent tooth decay today. But first, let's take a look at periodontitis. Periodontitis is an inflammation of the periodontium. The periodontium includes the gums and the jawbone. At first, injuries occur in some places, usually in the gingival sulcus, and this leads to inflammation. Dead cells and bacterial metabolic processes usually play the main role here. This is initially known as gingivitis. As soon as the gums lose their ability to adhere to the tooth, we speak of periodontitis. It progresses over years and decades. Gum pockets develop. Because bacteria enter the bloodstream, the inflammatory processes also lead to the breakdown of bone tissue. Since the gums are supported by the bone tissue, they follow it. The bone is broken down and the gums recede. The loose cell debris, food particles and more eventually solidify into hard tartar that is difficult, if not impossible, to remove at home. Other negative influences can also be toxic cigarette smoke or food residues that easily get caught in deep gum pockets. Drinks that are too hot or too cold can also damage the gums. The gums are often so damaged that a light touch is enough to cause bleeding. Finally, the periodontium steadily deteriorates so that the tooth can become loose and detached. The tooth wobbles and eventually falls out. Let's now look how we can possibly prevent or at least reduce caries and periodontitis. A good way to prevent tooth decay and periodontitis is to consume natural, raw, low-sugar foods. They can be considered as a natural toothbrush because they gently clean teeth and gums during the chewing process. The toothpaste is made by our body when we chew saliva. Saliva is a pure miracle cure for teeth and gums. It contains antimicrobial components that put an end to certain bacteria. Pain-killing components are also found in saliva, as well as many other health-promoting elements. In order for saliva to protect and restore teeth and gums, it is also important to breathe through the nose and not the mouth, especially at night, as mouth breathing leads to a drying out of the oral cavity. If you have difficulties with this, you can use breathing aids. But there are also many other possibilities, such as changing the sleeping position or surgery. In addition to raw, alkaline food, whole grain products should be preferred to white flour products. Whole grain products use the whole grain, but white flour products use only the carbohydrate-rich endosperm, which converts quickly to simple sugars in the body. Many nutrients are found in the bran and the germ, which not only protect gums and teeth. This is also true for rice. Natural rice, that is rice with the husk, should be preferred to white rice without the husk. Natural rice has far more nutrients than polished rice. Water, bitter herbal teas or green smoothies with a small amount of fruit should be the preferred drinks. After each meal, the oral cavity should be cleaned of coarse food residues with suitable means. Particularly in the case of deep gum pockets and crooked teeth, food can get stuck between teeth that leads to gingivitis, periodontitis, and caries. Interdental brushes and dental floss are often the right choice here. Care must be taken when flossing. Pressing too hard can loosen the gums from the tooth. This should be avoided at all costs. Today, brushing is often done with the Phones method. The brush head is moved over the teeth in a circular motion. However, the interdental spaces are only cleaned with difficulty or not at all. Also, it seems that the gingival sulcus and especially deeper gum pockets cannot be cleaned efficiently. The modified Bass technique is more favorable for interdental spaces, the gingival sulcus and pockets, as the bristles are placed at a 45-degree angle. Small jiggling movements in place loosen soft plaque. This is followed by a wiping motion to remove the loosened plaque. It is difficult to perform and takes time. Another method to clean sulcus and pocket is the Phillips blotting method. Phillips developed a special blotting brush for this purpose. The bristles have a special structure and are very soft. However, it is also possible to use very soft natural bristles made of badger hair, which have a rather irregular structure. The principle is simple. The soft parts, which attack the gums, are removed through dabbing. This is done without any pressure and without any toothpaste. The bristles are simply rinsed with water from time to time to clean them. The brush is placed at a 45-degree angle, similar to the modified Bass technique. Then a very gentle dabbing motion is done. Any pressure should be avoided so as not to damage the gums. The technique is difficult to learn. It should be shown by a professional and accompanied by a dentist. Once the bacteria, dead cells and more are removed from a tooth pocket, there is usually a recovery of the gums, preventing bacteria from penetrating deep layers. The hard-to-reach interdental spaces can also be cleaned with the Phillips method using the special blotting brush. A very soft toothbrush, such as the Curaprox Ultra Soft, can also be used. In any case, you should prefer brushes that are soft rather than hard. The bristles are placed at a 45-degree angle to the top. The interdental spaces are then cleaned by lightly dabbing. However, cleaning is done relatively uncontrolled and takes a lot of practice to avoid damaging the gums. Dental floss seems to be more suitable if it is used correctly, because it can be cleaned in a more controlled way. However, one should not be under time pressure and should act carefully, because, as already mentioned, the gums can otherwise be damaged. Regular floss is usually more suitable than floss picks. Interdental brushes are extremely efficient. They clean the interdental space very well when used correctly and in the correct size. They are highly recommended, especially for large interdental spaces. And tough toothbrushes can be used for wisdom teeth that are difficult to access. They can also be used to remove plaque from the gingival sulcus, pockets, and interdental spaces. The tongue is home to countless dead cells of the oral cavity and sulfur-producing bacteria, which can cause bad breath, among other things. In particular, the rear part of the tongue should be cleaned with a tongue scraper. Finally, you can clean the cheeks, palate, and other parts of the oral cavity where dead cells of the oral mucosa are also present. There are numerous other tools. How, when, and how often they are used depends on diet, the condition of the teeth, and one's own behavior. The dentist and relevant literature can help.
欢迎收听，今天我们来深入聊聊一个大家可能都想知道的秘诀，就是如何让我们的牙齿可以用得久一点，最好是用一辈子啦。我们这次参考了一部 YouTube 影片，它在讲怎么预防蛀牙跟牙周病，我们试着从里面找出一些重点跟大家分享。好，先快速讲一下基本概念哦。我们一般有32颗牙齿嘛，外面那层最硬的叫珐琅质。然后牙齿是靠牙骨质固定在骨头上的。那最常遇到的问题不外乎就是蛀牙，还有那个牙周病。先说蛀牙好了，影片有提到，大概20世纪初吧，就有研究发现，现代饮食里面，那个糖跟白面粉吃太多，可能是蛀牙的主因。这就会让口腔里的细菌生态，失衡。简单说，就是爱吃糖的坏菌变超多，然后他们把糖变成酸。酸就会腐蚀珐琅质，蛀洞就这样跑出来了。
这里有个蛮重要的观念，就是说口腔它不是一个独立的系统，会影响口腔菌群的食物，其实也很可能影响到你整个消化道。影片里有个例子，我觉得很有趣，就是野生的大猩猩。山地大猩猩它们几乎不太蛀牙，虽然牙齿会因为吃植物弄得黑黑的，但也因为这样，它们反而比较容易有牙结石、牙周病的问题。
那不一样的大猩猩呢？
对，像低地大猩猩，它们会吃水果啊、根茎类这些食物，好像会帮忙清洁口腔，所以它们蛀牙跟牙周病都比较少。这就点出，就是比较天然没加工的食物，可能真的很重要。
了解，所以蛀牙跟吃什么关系很大。那牙龈的问题呢？就是牙周病到底是怎么一回事？
牙周病，简单讲就是牙齿周围的组织，像牙龈，还有支撑牙齿的骨头发炎了。一开始可能只是牙龈发炎，叫牙龈炎。如果没有处理好，牙龈会慢慢萎缩，就没办法紧紧贴着牙齿，然后会形成一个缝隙，我们叫牙周囊袋。
听起来不太妙
对啊，这个囊袋就变成细菌的温床，它们甚至可能跑到血液里，然后骨头也会流失。最后牙齿就开始摇，甚至掉下来。抽烟啦，或者食物卡在那个囊袋里，吃太烫太冰的东西，都可能会让状况变更糟。
哇，听起来比蛀牙还麻烦。那该怎么预防？饮食还是关键吗？
绝对是，根本的方法之一，还是尽量吃天然、少加工、低糖的食物。其实你在咀嚼这些比较粗、比较天然的食物时，它们本身就有点像天然牙刷的效果，会温和的清洁。
靠吃东西顺便刷牙的概念，
有一点那个味道，而且咀嚼会刺激口水分泌嘛，唾液是很棒的天然保护剂，里面有抗菌成分，还有用鼻子呼吸也很重要，特别是晚上睡觉的时候才不会口干。所以饮食上，比如说选全谷类就比精致面粉好，糙米比白米好，多喝水或是没加糖的茶。
好的，饮食是第一道防线，那清洁呢？光靠吃东西够吗？感觉还是要刷牙吧。
饮食调整是打基础啦，但主动清洁绝对是另一个重点，两个都要顾到。吃完东西把残渣清掉非常重要，特别是如果牙周囊袋已经比较深，或者牙齿排得不太整齐的人。
清洁，我知道有牙刷、牙线，但好像还有很多工具，方法也有差吗？
工具是辅助啦，重点是原则。牙缝一定要清干净，所以牙间刷、牙线这两个通常跑不掉。用牙线的时候，切记要温柔一点，不要太用力，不然可能伤到牙龈。传统那种卷线的，通常比牙线棒好用。
那刷牙呢？我看过很多种刷法。
对，刷牙方式影片有提到几种，像环状刷法可能比较难清到牙缝，改良背式刷牙法就是刷毛斜斜的45度角对着牙龈沟，轻轻的小范围震动，然后再刷下来，这个效果不错。但可能要学一下。还有提到一个叫 Phillips Blotting Method， 是用很软很软的刷毛，也是45度角，但是用点触的方式，轻轻的把牙龈沟里的脏东西带出来。
听起来很温和哎。
对，强调完全不用力，甚至不用牙膏，重点就是选超软毛牙刷，然后技巧要对，目的是清牙菌斑，不是刷掉珐琅质。
了解。
当然，牙缝如果比较大，牙尖刷的效果会比牙线好，或者最后面很难刷的智齿，可以用那种单数毛的牙刷去加强。啊，对，还有舌苔也要清，用舌苔刮刀刮一下舌头后面，脸颊内侧、上颚也可以顺便清一下。
哇，细节还真不少。所以重点是温柔的清洁牙龈沟和牙缝，对吧？
没错，没错。温和但彻底。至于你个人适合哪种工具、哪种方法，还是要看你的牙齿状况跟习惯啦。不确定的话，问牙医最准。
好的，那今天这样听下来，要让牙齿健康用得久，关键好像就是两大方向。
可以这样总结，两大支柱。第一，就是从根本的饮食做调整，多吃天然、全谷、低糖的食物。第二，就是针对性的把牙齿清干净，特别是牙缝、牙龈沟这些容易卡东西的地方，而且动作要轻柔啊。还有，别忘了身体自己的保护机制，像口水呀、用鼻子呼吸呀，这些也很有帮助。
希望我们这次的讨论能帮大家更清楚怎么照顾自己的牙齿，这些其实都是可以马上开始试试看的步骤。
最后，留给大家一个可以想想看的问题。既然影片提到口腔菌群失衡，可能跟整个消化系统都有关，那么更仔细的去注意你的口腔透露出的讯息，会不会其实也悄悄地告诉你一些关于你全身消化健康的线索呢？